Hi, everyone. I'm Rejoice on Umatta Consulting Podcast. Today, we have a special privilege to speak with Sylvia. She's a PhD holder, MPA, a nurse, and also the CEO and founder of My Nurse Pal. Before we start asking our questions, I'd love for her to introduce herself as she sees fit, and then we'll dive right into the questions. So, Sylvia, the mic is yours.
Okay, thank you so much, Rejoice, for having me. I'm a nurse researcher and educator. I started my career as a biochemist in Ghana, and then once I relocated to the US, I pursued a master's in administration, and then nursing was a second career for me. Since being a nurse, I've done many things. My area of expertise was in rehab nursing, and I have somehow found myself in long-term care. And I've been in the long-term care space I started off as a CNA. Whilst I was doing my master's, I did CNA in the evenings, and automatically I love nursing, so I kind of pivoted there. So I would say for 20 plus years, I've been in the healthcare industry. Currently, I do teach adjunct and I also do entrepreneurship full time.
Amazing. I love your background. Thank you so much for that information. So, our first question for you, can you tell us or share with us your journey as a nurse and how you became involved in healthcare and AI in general?
Well, I think I've answered half of the questions already. But yes, I started off as a CNA. That was my first contact with healthcare, and I loved it. And so I pursued the nursing career, and I must say that I've really enjoyed every bit of it. In 2013, I went back to get my PhD in nursing, and since then I've been doing research. I've been doing some academia, and I also went back into long-term care as a director of nursing, and that is what actually has stemmed or has kind of sparked my passion for workforce development from what I kind of experienced in my role as the director of nursing. And so that's just my career so far. Yeah.
Awesome. Awesome. Why is it critical for business owners and nurses to embrace AI in your opinion?
Oh, wow. AI is the new, aside the fact that it's the new buzz, I think that I embraced it very, very early. Once it started to come out, I wanted to understand AI. And I realized that it not only did it make your work a lot more efficient, but it was going to streamline all our problems. So knowing the problems that nurses faced on the job, for example, and I've always had a dream. In fact, I tried my first attempt at developing an application way back before AI was a thing. And I was trying so hard to see how best I could streamline the nurse's workflow. That application actually informed this current application. And so I would say that as far back as that time, we were looking at using technology to help solve some of the nurses' challenges on the job, which was causing them a lot of stress. And most people leave obviously because of stress. So when AI came on board, I saw there was a great wide open opportunity where we could utilize AI to streamline the workflow as much as we could so that we could make the nurses work easy. Because so let me just tell you a story. So during COVID, we were short staffed. Okay. So after COVID, I happened to be a consulting DO in one of the buildings, and we were down to one staff. In fact, the staff did not show up. It was almost like 8 a.m. There was no staff. So I had to quickly get onto the unit to work. And I hadn't done direct care for a long time. So when I went onto the unit, I realized that with the EHR, everything had changed. Yes, we always had workloads that were heavy, but it was doable because we were using the manual charts, and you could actually the MARs, and you could actually color code. You had pins, we could color code, and we could actually organize ourselves such that it made the work, though it was still a heavy workload, we made it so much easy. With the coming of the EHR, I realized that I couldn't do that. And you couldn't
Wow.
even foresee who had the next med coming up. So when AI came on board and I was already developing an app, I wondered, what can I do? Because now this color coding system, the way we organize, the way nurses work, we could really utilize AI to replicate
Yes.
some of these things. And so that is how I started to think, of a framework or a model where I could bring our past experiences into the back into nursing so that we could actually ease the workflow. So now I can anticipate based on AI, can go in and get all the information I need to plan my day and make it much more easier. And so hopefully I think we are on the right path. We are looking to cause a
Yes,
lot of changes. So I'm excited about for that. Can't you
absolutely.
tell?
Absolutely. Actually, I love that you pointed out COVID because we know during COVID there were so many burnouts with nurses. People were exiting the field. It was a little bit challenging and scary for all of us. I'm just curious, how do you feel that AI can potentially minimize burnouts and also shortage of staff?
Oh, the solution is my next pal. So I did a lot of literature, review and a lot of research, and there are few things that really causes nurse to stress on the job and therefore leave. One of them, obviously, is workload. One of them is lack of supports. One of them was lack of, opportunities for professional growth and all of that. So the literature screams that, in fact, contrary to what many think that it's money, money is hasn't really the literature hasn't really supported that as much. That I believe that if the workplace is supportive and all of these other elements are in place, yes, money plays a role, but not the biggest role, right? So we decided to come up with a tool like AI tool like my NursePal, which addresses all of this. So my NursePal is a tool that helps you to streamline your workflow.
Okay.
So now the good news is that you can just come to work right from the start, hand off. You have to just, while the handoff is happening, you can speak into your phone, you can text or a tablet, whatever tool you have, you can text, you can write to text, you can voice it. And once you do that, there's an AI that tells you, suggests your next steps. And
Wow.
we have trained this AI for the last 2 years, and it's able to adapt and use the nursing process to outline your to-do list. Now, not only that, once you go through all your room by room shift reporting, it's also able to, once you create it gives you the suggested to-do list, you actually go in and create your to-do list.
Okay.
And we also are integrated into EHR systems. And our goal is that we should be able, as an AI agent, be able to give you a synopsis of the person you are looking at. If
Okay.
acuity changes, the priority changes.
Mm,
So in real time, nurses are able to manage and prioritize their times. And this is working fantastic. Now, the beauty is that it out of this, all that every time you do a task, we want you to interact with your tool, either you're writing it in or all that. At the end of your shift, everything comes together for your shift reporting, and
mm,
then you can generate your skilled notes and it integrates into an EHR system.
wow.
So now it's made all the administrative work so easy for the nurse. In
Right.
my opinion, I wish I had something like that when I was a nurse, right? So now you just show up and be the nurse and
Right.
let the administrative part. Well, the good thing is that you get to edit this too. I know we always want control. So we
Right.
made sure that nurses can go in and make it and make it their own, edit their notes, add onto it. And the beauty about this whole thing is that, especially for a piece for long-term care, this is applicable in all settings, by the way. So any nurse can use that across board, and it's not just US; it's global. And
Okay.
then they also we added features for support. So there's going to be a mentorship community in the app, so you can set up your mentorship, right? So that you can be able to be mentored all through. We also included self care features because we know nurses stress on the job. So we
Hmm.
have a reflective journal. And as you reflect on your journal, there's an AI emotional support person in there that
Wow.
takes on your emotions and actually kind of encourages you. And
Right.
then we also have a nursing coaching tool. So if you're a new grad, or even if you are not familiar with a medication, not only can you look it up, but if you wanted, say, suggestions or interventions for your care plan, you can actually input that. Any nursing process that, and we have really trained it on the nursing process using the critical judgment model and all of those ideas, the nursing process models. It's able to help with some things that you are not really sure about. But I always would say that nurses are nurses, and this is not to replace the nurse at all. You still have your critical thinking elements. You went to school for that, and you always have to use your clinical judgment. But boy, that's about 80% for you, and you have the 20% or even less. I would say I just am being very conservative. Yeah, I am being very conservative because we have tried it and it's brilliant. It does so much. And so now, another thing that I wanted to address was bullying.
Okay.
So, nurses are busy, and
Right.
they're busy, and rightly so. So sometimes when you're going with some petty questions to a peer,
Right.
sometimes it doesn't come off well. You know what
Yeah.
I mean?
Yeah.
Yes. So I'm saying that now with those little questions that you always would run, we could AI could help you with some of them. And still, maybe it will not answer all of it, right?
Right.
Sometimes some of them are very specific. Then, yes, you're going to seek your mentor, which again, now your mentor is right in your pocket, right? So you
Right.
can shoot them a text or shoot them a message, and hopefully they should be able to come to your aid. And then I know nurses don't use the bathroom. So we also make sure that we have self-care notifications to use the bathroom, to take a hydration break, and we have a pedometer in there. So we track, or you can track your number of steps. Your stress level is also tracked, so you
Mhm.
can tell whether you are too stressed, right? And the beauty about this is that it comes with its own organizational portal, like
Okay.
a SaaS system. So again, you know how management in nursing, it's always difficult to assign. Like when a new admission comes, who gets the new admission, right? And sometimes the acuity changes with time. So now with this system, the acuity can change enough or can predict the acuity such that a nurse manager would be able to know that, okay, you are struggling.
Right.
And so or at this point, you are struggling. So I can assign this to Nesb at this
Right.
point, right? And so it's going to help to ease the stress burden on the work
Mm.
burden on all staff. And it has a lot more. I mean, I can go on and on and on and
Yeah, I mean, it's amazing. From what I'm hearing, it sounds like a dashboard. You have created dashboards to measure metrics from
yes,
productivity, from stress, from needing some sort of encouragement, like a coach to a mentor. I feel like you have covered all different stages that, like, maybe someone who's entering the workforce for the first time may need that support, or even someone who's in a new area that's not their area of expertise, or maybe they forgot some things that they're supposed to know. So that's actually a really good tool for nurses to use at their day-to-day work environment, which, from what you're saying, it also will probably reduce turnover,
yes,
attrition, people leaving maybe of unhappiness, or something was not detected early, or maybe support that they were looking for. So that's all amazing. I think
I
people
know.
really appreciate that support. So, going along with what you're saying or sharing with us, how do you ensure AI complements, rather than replace the human touch of nursing? Because some people may say, okay, if 80% of the administrative task is completed by AI, what would you need a nurse for?
Oh boy, you need a nurse for everything nurse. And the administrative part, yes, it's good to document because of all the legalities and all of that. But really, we didn't go to school to only document, right?
Right.
We document, yes, to understand trends, to know what's going on, to be able to communicate with our interdisciplinary team and all of that. So yes, documentation is fantastic. But most of us, if you ask us, we went to nursing to care for the sick. When we
Mm,
go in, because of this burden of documentation and the workload, I don't know if you've had the same experience. You go in and you feel like the nurse is rushing off. Have you had
yeah.
that? And
Yes.
she's
Yes.
pressured. She wants to talk to you. She wants to listen to you,
Right.
but she can't. She feels almost like she can't be a nurse.
Right.
So AI, that's the magic of it. It allows me to walk into your room knowing very well that I have that extra 5, 10 minutes to talk to
Right.
you. And
Right.
sometimes it's not the medication, it's that humanness, that
Mm,
emotional connection we have with our patients, that empathy that we can give off of them. right? Is the key, you know, and being holding their hand. We
Right.
wish we could do more of that, but we can't now. So with AI, I think that nurses should really look at the prospect. And to answer your questions, we can't allow non-nurses to do tools for nursing. I'm just going to tell you that. Because when you are a nurse and you go into the field with that mindset,
Right.
I see AI as a tool. I see AI differently. So I'm not going to create a tool that is going to replace that human touch of
Mm,
nursing, because it's all, and you have to know that there's also a lot of ethics
right.
involved with with patient data and things like that. And
Mhm.
so, with our training as nurses, it has been drummed into us this HIPAA regulations and privacy and all of that. So, guess what you want? You want a nurse to be able to use this AI tool and develop a tool that meets compliance
Mm,
true and true. And we also want a tool. There's one thing I didn't mention about this feature. So we've taught this tool to identify the CMS regulations, the JCO regulations, and all of that.
right.
So if you are putting in a task, right away it's customized to a facility. So their policies is embedded in this application. So AI
Wow.
reads it and right away will tell you what forms to include. Sorry,
Right.
what forms to include and all of that. So that is one of the
Features.
beautiful features that this app also brings, and I needed to bring that out too, so that it tells you that a nurse thinks about everything when they are developing a tool for nurses.
Absolutely, absolutely. I love that feature. I think that that's you're thinking way ahead of the times. So that's amazing. What role should nurses play in shaping AI in the future of healthcare?
So we have to take AI on head on. We have to educate ourselves. That's the first thing. We do not have to look at it as a threat. It's rather going to help to support us if we understand it. It becomes a threat if you don't understand how it works.
Mhm.
But within the last 2 years, I have educated myself a lot. And and trust me, I've worked with developers and software engineers all this while. I have a close team that work together, and they've taught me so much. And even we are looking at even greater things with AI. Nurses that are out there, I want you to just take a moment and explore what is out there.
Mhm. Mhm.
As an educator, I always tell my students that yes, I do not want you to cheat with AI, meaning that let AI write your papers, but I want you to be curious enough to explore what AI can also do,
Right.
right? Because we cannot create nurses who are not current with technology. We
Right.
can't, you know, and I know most of us are scared of technology, but we have to work with it so much that we will love it,
Right.
right? So yeah, my next power works in education also. I just didn't mention that. So we are looking at simulations and all of that with my next power, because you can put in so much of a heavy workload and you can
Right.
actually simulate prioritization of tasks and time management and all of that. So I can't even tell you, it's endless. Yes.
Wow. Amazing. Amazing. I always admire nurses that work 12-hour shifts. I mean, 3 days back to back, 4 days. To be honest with you, I don't know how you guys do it. But kudos to everyone who's brave enough to take that task. Do you feel this will also help with the long hours, or do you still foresee maybe the
Oh,
long
yes.
hours will stay the same?
Well, the long hours really is because of the nurse shortage. If you staff a 12-hour shift, you use less nurses than when you do an 8-hour shift. So that is usually a facility by hospital policy, right? But again, in terms of again making your work a lot easier and streamlined, this
Right.
definitely is going to help, because you're not going to document in three places, because
Mhm.
we are getting to a point with this tool where based off of your input, we can create your assessments from it.
Right.
So you just have to select what you want, and then we integrate it into a system. Now the integration part is the problem. So we are even thinking of maybe doing our own. So that is something that we are. That's our next phase and our next steps. We will create our own. So if we're having trouble with, but so far we are integrating into Epic, PCC, and MedTech, and we would integrate into more systems. But right now, posting is always a thing that they guard against. So we are trying to work with them to see if we can let that happen so that the nurse
Excellent.
doesn't have to. I mean, you come in, and guess what? We also have a multilingual system in there. We are thinking of
Wow.
translation. It's because to take care of our multicultural workforce. So
Yes.
again, when you can't really speak English too fluently, but you've done the assessment and everything, the nurse's note is legal. You have to make sure that you have all the keywords in there, right?
Mhm.
And make sure that you've all the things you did, you've registered, you've actually documented it just to safeguard you. We got you covered. So
Right.
you just speak your language and your notes comes in English, and we are working on that technology. So we are
Mhm.
so excited about our application.
I'm I'm actually very curious about that.
Yeah,
What you just shared with us.
yeah, yeah.
Would that potentially also help with communication with clients too? Let's say a client is a Hispanic client that may not necessarily speak English. Would the nurse be able to maybe take some keywords to say
Yes,
hello, or like hola, cómo estás?
yes.
I'm just curious.
Yeah. So I was more focused on the next part of it, but yes, I can see how, because there's a recording tool to it, like you can actually record your voice to text. I definitely, you can ask the client to record it, and then translation can occur in real time. So with their consent, obviously. So yeah, that's not something that we're not looking at the patient end of it. We're looking
Okay.
at more of the nursing end of it as a
Okay.
nurse tool. But yes, that's definitely something that definitely we could do. Yeah.
Amazing. Amazing. So many ideas out there right now.
I
It's so
know, I
exciting.
know. There's so many, and it's endless. The
Endless.
beauty about this is that anyone who has had a demo with this application has given us more ideas and
Wow.
more use cases, which blows my mind.
Wow.
Even caregivers, informal caregivers. During the beta, a couple downloaded the application that were informal caregivers,
Yes.
and they could see use for this, and it was like, wow, this is fantastic. That we were thinking we're doing something for nurses, but it looks like it's a caregiving app.
Right.
And
Right.
so yes, it's a caregiving system, and I can't wait. I can't wait for it
Wow.
to be launched, and we get the right financing for the product, and then
Yes.
I know we're going to go to great heights.
Amen. Awesome. Awesome. So, doing your testing, your beta testing, what challenges did you run into and how did you overcome those challenges?
Okay, so pretty much we had been doing a lot of we actually built it with nurses. We had a team that we always would go to, so they've tested it enough. So when we started our beta testing, to be honest and sincere, we have been blown out with the reviews we've gotten. But there's been still a few suggestions. They were not bugs per
Oh,
se. They were not technical suggestions. They were suggestions of. I think it's loaded with application with features, and like people were like, "Oh, can we?" There's a communication. There's a community within it, which is mentorship, and they were asked, "Can we communicate among ourselves as nurses?" Those kind of things. So we haven't. Again, just to be cautious, we have 35 people just downloaded and started using it. We are
okay.
yet to test it on a big sample to
Scale.
see, and we are actually looking for facilities who would want to pilot the product,
Okay.
and so that will give us also another dimension as the organizational features of it,
Right.
because with the nursing there's limitations because they can't use the integrative part of it because
Right.
of HIPAA. So with organizational piloting, we get to use the integration feature. So I bet. But right now, we are very happy to say we haven't really gotten any big. But it's been 2 years since we started doing this, so we've
Right.
tested it enough, and so yes, yes, and so
Awesome.
we haven't had any big um, problems with the technology. It was well done. Yes,
Awesome, awesome,
yeah.
awesome. We're towards the end here, and we'd like to know if you have advice for anyone who's in healthcare, a nurse, or is interested in using technology or want to create their own technology. What advice or suggestion would you give such person?
So the that's a good one. It all depends on the team that you surround yourself with. The team
Right,
is so important.
right.
I tried once doing but it wasn't the right team.
Okay,
So the vision was not fully captured.
okay,
Okay. Now I've been just fortunate. I have a fantastic team. I have close a person I work very closely with, and he is so much vexed into AI and machine learning. So he's been able to capture my vision. So I work with also a designer who actually was the one that designed, make the application very intuitive and very look. It looks very appealing
Okay.
and very nicely designed. And then I have two other softwares who help with the different aspects. So we have a team of we are five right now, and they are great. And
Awesome.
that's what you did. So the first advice is get your ideas into a concept, try to sketch it out and be clear on how you want everything to look like, and then get a team to put a team together
Oh,
and be able to share your vision with the team. And they will teach you as much as you will teach them because they are engineers, they really are
yes.
not nurses. So they
Yes.
really don't know the nurses workflow. So when they design something, I was like, this looks so great as a software. It looks great on paper, but it wouldn't work for us, right? This is
Right.
how we work. So I had to actually do a workflow and
Okay.
actually tell them how. So I took time. So like I said, and then how do I even teach the application or the language that it should identify, or
Mhm.
to prompt it to take the nursing process. So there's a lot of research that goes into that part of it. And with just working with them so much, I've been able to understand a lot of their language and their keywords. And I've also done a lot of reading
Right.
um, and learning a lot of things myself so that I could also prompt what is necessary. So I told them this: this is just the I we just want this is just believe it or not, this is just the minimum viable product. The
Mm.
the goal for this thing is endless.
Yes. Yes. Amazing. Amazing. You know, one thing I took away from what you shared is regardless where your expertise are, once you start getting involved in technology and AI, you're also going to start learning other areas to become an expert in it or even somewhat knowledgeable of
Yeah,
technology,
yeah,
which is amazing. I think the
yeah.
beauty of the integration of skills, abilities, teams, that's what makes me excited about what people are doing in technology. It's just encouraging everyone to step outside of their silos, emerge into other areas, and develop their skill sets. So kudos to you. I think
Thank
you're doing
you.
amazing time, amazing job with your team. And as we're wrapping up the discussion, how can listeners stay updated with what you're doing or stay in touch with you? How best do you think they should contact you?
So I'm present on LinkedIn. I'm very active on LinkedIn. You can find me on LinkedIn. You can I have an book an appointment. You can book an appointment anytime. You have access to my calendar, and then I'll be willing to jump on a call and just talk to you. So that's one way. Or you could go to our website www.mynetspal.com, and that is where we recruit our beta testers for the beta testing piece of it. So either way you can get me. Yeah.
Awesome. Awesome. Thank you so much, Sylvia. And thanks for your time. And we appreciate everything you've shared with us today.
Thank